Hey guys, welcome back to my channel. I'm Sukriti. I hope you guys are doing well. And today we're going to talk about PMS, premenstrual syndrome, PCOD and PCOS, that is polycystic ovarian disorder. Finally coming on to the treatment of the disorder. So the 5 common factors that every female needs to keep in mind is that number 1, we need to be good on our physical activity. Number 2, we need to have protein rich foods in every meal, preferably plant-based proteins. We need to cut down on our sugar and caffeine, to cut down on our simple carbohydrates, that is refined wheat flours and sugar, honey, etc. And lastly, we should have a weight managing diet. That doesn't exactly mean we need to have a weight loss diet. We need to have a very balanced plate so that good health follows weight loss. Another question that comes up is usually about intake of dairy. So that is very individual specific. You need to always risk, try and do. So what you need to do is you just need to observe your body, that during that certain period of time, are you able to consume milk or other milk products easily and you're not having any acne or other side effects. That means your body is readily accepting dairy, but if there are some side effects, you need to cut down on your dairy in that specific period of time. Nowadays, people are usually creating misconceptions in their mind about intake of dairy during menstruation because some types of dairy products are injected with hormones which do react in their body, and hence the body is not very readily able to take dairy. But there's absolutely no study that directly relates intake of dairy and increase of premenstrual syndromes. How do we manage PCOD with diet? Here I want to tell you that PCOD can be totally managed with the help of right amount of physical activity and a healthy diet. You do not necessarily need any medicines to cure PCOD. So now there are these specific nutrients which need to be taken in good amounts so that our hormones in the body remain balanced, and then it's a cakewalk for us. Starting with magnesium. Magnesium is one nutrient which is really good for muscle contraction and relaxation. So it can really help you with menstrual cramps. So tanking up your body with dark green leafy vegetables, nuts and seeds, avocados, whole grains and cereals is really good to have. Secondly, iron and folic acid consumption should be up to the compensate for the blood loss happening in the menstrual cycle. Moving on, vitamin B6 and B12 are really good to cure your fatigue, tiredness, water and fluid retention during this time. So we need to tank our body with, again, dark green leafy vegetables, milk and milk products if you can tolerate them. Fish, oats will definitely complete your needs for vitamin B6 and B12. Whole cereals and whole pulses also contribute to the requirements of vitamin B12 and B6 for our body. Lastly, how can we not talk about water? A dehydrated body supports cramps. So there is need to have 2.3 to 3 liters of water daily, and especially during this specific period of time. Cramps live better in a dehydrated body. Also, a dehydrated body can suffer from constipation, gas and bloating. So there are higher chances of having abdominal pain and other premenstrual symptoms. Consumption of lean protein and other sources of plant-based proteins is also preferred because they keep our sugar cravings at bay by not also adding extra calories. Apart from these specific nutrients, there are some other food products which also help to minimize PMS, that is roots and tubers like suran, arbi, sweet potato. Fruits like banana also helps us with migraine. Apart from this, we have a miraculous solution for hormonal balancing, that is seed cycling, which we'll be talking about in the next video. If you have any questions related to PMS or PCOD, please drop them down in the comment box. I'll try to answer all of them. See you in the next video.